So a close friend of mine recently had appendicitis, and that inspired me to create this video. What is the appendix and how does appendicitis happen? Let's find out. So this is the digestive system. The main purpose of the digestive system is to process and extract nutrients from food. So when we eat food, it travels down into the stomach, and then from the stomach, it moves into the small intestine. The small intestine is where a lot of nutrient extraction takes place. It then moves into the colon. The colon, for obvious reasons, is also called the large intestine. The beginning of the colon is called the cecum, and hanging right off the cecum is this little tiny finger-like projection called the appendix. Think of the appendix as a narrow tube or cave that hangs off part of the colon. And more importantly, the appendix is blind-ended. In other words, it doesn't actually lead anywhere. But the real question is, what is the purpose of the appendix? This is something that's actually been debated for many years. Some scientists believe that in the past, the appendix was larger and aided our ancestors with digestion, but over time, it shrank. But recent, more compelling data has shown that the appendix actually plays a role in the gut immune system. Here we can see a slice of the appendix that's under the microscope, and in this layer we see that it's really rich in lymphoid follicles and lymphocytes. Those are immune cells. This immune tissue in the appendix is actually a major producer of IgA in the gut. IgA is an antibody that coats most of the surface of our digestive tract. This antibody can bind to and neutralize a lot of germs that we inhale and digest, and can help prevent us from getting sick. Now on to how appendicitis happens. Remember how we discussed that the appendix is like a tunnel? This is a picture that was taken inside of someone's colon, and as you can see here, this is the entrance that goes into the appendix, the tunnel. So what can happen is sometimes a piece of fecal material can go into the appendix and then get stuck in there. Once stuck, mucus, secretions, and bacteria can't travel anywhere, so they become static and infected, and bacteria start to multiply out of control. As the appendix becomes more infected and inflamed, it starts to grow larger. Increased tension within the wall of the appendix due to swelling and inflammation can actually lead to the blood supply to the wall being cut off. Cutting off this blood supply, combined with increased invasion of bacteria into the appendix wall, will ultimately lead to cell death or necrosis within the appendix. And as pressure builds and the wall becomes even weaker from all the cell death, the appendix can eventually burst, releasing all of this nasty content and bacteria and stool into the abdominal cavity. This can even cause a worse infection called peritonitis. The other way appendicitis can happen is if that immune tissue that we talked about earlier starts to proliferate a little too much. This can sometimes happen in response to an infection. This excessive growth of immune tissue within the wall can also lead to obstruction. And once again, cutting off the blood supply, bacterial overgrowth, cell death, and then leading to perforation. And that's how appendicitis happens. Let me know in the comments what you want to see next, and thanks for watching.